All right, moving on to question number 5. For question number 5, the terms which we need to understand first are myocardial hibernation, ischemic preconditioning, myocardial scarring, reperfusion injury, and ventricular remodeling. So what is myocardial hibernation? Well, the name gives it away. It's hibernation. So what happens is, when the blood supply to your heart is compromised transiently, what heart does is it slows down its contractility, it slows down its contraction, its pumping, so that the blood supply that is compromised, and now we have the less blood supply, that less blood supply could compensate for the amount of contraction the heart is doing, so the ischemia would not set in. So it's basically a hibernating condition in which the heart just slows down to just use the amount of blood it has, and just does not die. Basically, it's like a really efficient way to combat myocardial ischemia. Second is ischemic preconditioning. Basically, it's a condition in which the heart, it prepares itself for ischemia, so that it could face ischemia real well. So it's just a way that sometimes if you have to face like a boxing match, then you would just like train yourself in a way that you would hit your face a couple of times, a lot of times, multiple times every day, so that you get used to those hits, so that when the actual hit comes, it just doesn't really hurt that bad. Same thing the heart does is that it sees that the blood supply it's going to get compromised. So what it does is it slowly reduces the blood supply deliberately. But even when the blood supply is there, it slowly just deprives itself of the blood and gives it small amount of ischemia, so that when the actual ischemia sets in, it doesn't hurt that bad. So the person he experiences repetitive episodes of angina, obviously because the heart it's temporarily and very transiently blocking its own blood supply just to have those small amounts of ischemia to prepare the heart for the upcoming ischemic attack. The third is myocardial scarring. Well, we all know it's the scarring of the myocardial tissue, and the myocardial tissue is replaced by smooth muscle, by connective tissue, and there's loss of contractile function. The heart is no longer able to contract. And then there's reperfusion injury. Reperfusion injury is when the heart it's deprived of blood, and then the blood supply is restored. The free radical damage, it's all that, when the heart's blood supply is restored, there are free radicals formed, and then those free radicals actually increase the cardiac damage. So it's basically when the blood supply is restored, the heart continues to face damage. And the last is ventricular remodeling. Ventricular remodeling happens when there's heart failure, and due to heart failure, renin-angiotensin system gets activated and causes the formation of aldosterone, and that's aldosterone then causes the cardiac hypertrophy, and then that cardiac hypertrophy or cardiac remodeling alters the ejection fraction. That is called the ventricular remodeling. So let us just now go to our question and see if we could solve it. So now the question is, he has a history of hypertension, type 2 diabetes mellitus, hypercholesterolemia. His blood pressure is 130/80. Blood pressure is increased. Pulse is 72, slightly increased, almost normal. Cardiopulmonary examination is normal, with the exception of a fourth heart sound, insignificant. Echocardiogram reveals hypokinesia of the interior wall of the left ventricle and left ventricular ejection fraction of 35%. Normal left ventricular ejection fraction is 40, and less than that would be reduced ejection fraction. So we know that this is a case of cardiac failure with reduced ejection fraction. The patient undergoes coronary artery bypass grafting. Now that's a key point over here, that they are telling us that previously there was the obstruction of a vessel, and now they have cleared that obstruction with coronary artery bypass grafting. Repeated echocardiogram 10 days after the surgery shows that hypokinesia is no longer evident, and left ventricular ejection fraction has increased to 50%. So that it's telling us that with the restoration of blood supply to our heart, the hypokinesia is gone, left ventricular ejection fraction has come to normal. Which of the following best explains the changes in the cardiac contractility and the wall motion seen in this patient? So what has happened, that Immediately after restoring the blood supply to our heart has started to function back again to its normal level. Could it be hibernating myocardium, that all this time the heart was just slowing its cardiac contractility to just use the blood it has and just not undergo ischemia, and as soon as the blood supply is restored, the heart has come back to us? Or is it ischemic preconditioning in which the heart gives itself transient attacks of angina? Or is it post-infarction myocardial scarring, in which the heart is scarred, and even though if you just restore the blood supply, the heart would not start contracting because the contractility is lost? Is it that? Or is it reperfusion injury, in which you restore the blood supply and the heart continues to deteriorate? It starts having those arrhythmias, it starts having all those other problems. Or is it ventricular remodeling, in which a heart, it undergoes remodeling phenomena when the heart failure sets in, and it is like permanently the heart is disfigured, and as soon as the blood supply is resumed, the heart comes back to us to its normal condition. So you're right, it's hibernating myocardium, because the heart was just slowing itself very transiently, because it saw that because there was obviously the the reduced blood supply to the heart, so it just goes into that hibernating mode, and as soon as the blood supply is reduced, boom, it's back on. So you would ask, why is it not ventricular remodeling? Well, ventricular remodeling is more of a chronic phenomena, and there's like permanent remodeling of the heart. So if you reduce the blood supply, if you just like reperfuse the blood supply with the blood it had, and remove the obstruction completely, it would take months and years to come back to its original shape. So we would continue having that reduced ejection fraction. It would not be resolved in just 10 days. The time 10 days over here is basically our cue that tells us that it's an acute setting, and it can only be seen when we are having our hibernating myocardium condition. So that's our fifth question done.